So Matthew Holt, I'm here in Washington, D.C., and this is the Healthcare Incentive Innovation Institute. This is their plan of action, and this is Francois Debrantes, who is the President, CEO, and Chief Cook and Bottle Washer of the whole organization. Well known for previous stints at Bridges to Excellence and Leapfrog and elsewhere, and also way back when at GE, correct?
Correct.
So tell us a little bit about, we just had a great meeting, a couple of hundred people here discussing incentives in healthcare, an issue we know has been a problem for a long time. What have you guys been doing about the whole issue, and what are you doing next?
Well, what we mainly been doing is trying to focus on reducing bad incentives and trying to get out of the way of physicians and hospitals doing what they want to do. I've kind of boiled it down to a relatively simple concept, which is that incentives should be designed in a way that encourages folks to do right as opposed to encouraging them to do wrong, which is what the current incentives do. So we spent the past 10 years developing programs, testing them, field testing them, refining them to the point where they're used by many payers and providers across the country, and they're doing their job, but now we need to set our sights on the next chapter.
So we were talking earlier offline about somewhere between 10 and 11% of healthcare dollars flow through something that looks like a value-based system with the correct incentives. We heard quite a bit today about how to maybe change that and some of the obstacles in the way. What is HCI3, as you guys call it, doing about that?
Well, what we're trying to do is to move the dial sufficiently so that we shift towards a far greater level of affordability in healthcare. And 10% of payment that encourages physicians to do right as opposed to 90% encouraging to do wrong is not the right split. We don't know what the right split is, and I think that's really the task ahead, is how do we figure out a mix of payment that's going to get out of the way of the professionals doing the jobs that they want to do. So it's going to take a lot of experimentation, and what we actually need to move towards as an industry is far more rapid cycle learning, improvement, testing than we have today. And that's part of what our organization is focused on.
So what kind there are a lot of people here today from different organizations, business groups on health, payers, providers, medical societies, and a bunch of others. What kind of alliances and are you putting together, and what kind of practical things can we expect to see from you?
I'm not sure it's an alliance more than it's the willing few. So those who are really committed to changing the system, who are willing to take some risks, to share the results of that risk-taking so that as a community, a learning community, we can all figure out faster what needs to be done and what shouldn't be done. And this is going to involve everyone. It's going to involve payers, it's going to involve employers, it's going to involve providers. And each one has to make some sacrifices. We heard today that most employers haven't yet pulled the trigger when they need to engage their employees and dependents far more into the healthcare decision-making process. They're still highly paternalistic, and that needs to change. Providers need to take on more risk, be willing to take on more risk, but in a measured way, in a way that's not going to harm patients, but in a way that's going to still hold them accountable for the results of the care that they're giving. And finally, payers really need to become far more open and transparent with what they're doing and modify some of their approaches so that instead of taking a heavy hand, they instead collaborate more with consumers and employers, so that the perception that most people have about health plans as being the evil guy shifts to, no, they're a facilitator for change, but they're facilitating in a specific way that actually improves the system as opposed to just worrying about bottom line.
And talk a little bit about the role of the government, especially Medicare, and being a bit more transparent, a bit more open. You were quite vocal about that.
Yeah, so CMS obviously is doing a fair amount of things. It's not clear whether they're always doing the right thing, but at least they're trying. They're sending a signal to the market. We're hoping that some of the initiatives that they've launched, they will make mid-course corrections on because they're going to have to. Most of what we're doing in value-based payment is new, needs experimentation. We shouldn't stop the experimentation, but we should all be willing to make the mid-course corrections that are needed when we find obstacles or when we learn something that's important enough that we need to apply right away.
All right, and finally, last question from Australia. So you have this rather impressive chart here about what you're going to do next. A couple of the things you announced today include some online tools and also some sort of commitment to being involved in value-based payment and spreading the word. Give me a couple of ideas, a couple of lines about what's going to come.
Yeah, so we're we're basically launching a series of tools, but our central tool is really a mechanism to educate employers, other purchasers of healthcare, as well as providers about the areas of care that they need to focus on. Not every single area of care, condition, procedure requires the same type of activity in order to improve it. And what we're doing is trying to dissect what's wrong and what you can do to fix it, but bringing folks within this learning collaborative so that instead of learning by oneself and then everyone relearning it, we do it in a way that is in a shared learning and communicative group.
And how do people find out about that?
Well, you can come to our website, www.hci3.org.
That sounds great. Good way to start. I've been talking with Francois Debrantes, who's the president of the Healthcare Incentive Innovations Institute. It's a long way to say that. HCI3 is the easier way. And I've been on a great meeting today in DC. Francois, thank you for your time.
Thank you.